Come back to Breaking Dawn, people. We are 9 minutes away from the hour of 8 o'clock, and for that period of time from now until 8, we will be joined by Seth Wildeboard, who is with us via Zoom. Bring him in. Nice. Seth, topic today is?
Good morning. Endometriosis.
Endometriosis. Nice, man. What is that?
Alright, so endometriosis, of course, when you go into the etymology of the word, endo meaning inside, metriosis meaning, well, metri has to do with the material plant, the wound inside the wound, and oasis has to do with disease, sickness. So it's when the tissue of the wound is growing outside of the wound. So, of course, I'm going to share my screen to have us see some images of this. So this here,
right,
as you can see, would be the wound with the fallopian tube, the ovaries and whatnot. Right, so the tissue from inside here, the endometrial tissue, when it starts to grow in places outside of where it's designed to grow, that's what we call endometriosis. So all these lesions that you see in here, in these areas, that is what we call endometriosis.
Okay.
But endometriosis don't just grow in the outside, on the external part of the wound. It can grow on other parts of the body as well. Usually areas like the rectum, the colon, and the small intestines, it can grow as well. And in some rare cases, you can get it growing in abdominal tissue as well, in the abdominal muscle.
Right.
That is usually due to scarring from cesarean section, which is probably another topic we might deal with, because cesarean section is not something that should be pushed or promoted. Some people choose to do it without complications, right? Meaning that they didn't have complications, but they prefer to do that, and that should not be. All right, and other people that develop complications would do cesarean sections. But there are ways around that to prevent yourself from getting complications in pregnancy where you'll have to do cesarean section. But that could be a topic for another time. Right? So endometrial tissue, when it starts growing, remember this tissue operates like the tissue in the wound, even though it's outside of the wound. So it would expand, it would break down, it would bleed when a woman is having a menstrual cycle. Just like the tissue within the wound, it operates the same way, it's just in the wrong place. All right. Yeah. So this can cause a lot of problems. In fact, many cases, let me close the screen a little bit. I guess we already have the image in our heads here. Right. In fact, many times it's usually misdiagnosed. Right. In fact, when you think about it, from studies, it's usually at around 75% of the time is misdiagnosed as some other physical health condition, and 50% of the time is misdiagnosed as a psychological condition.
Okay.
Right? Because many people might just, it's unfortunate, but some people might just tell a woman, it's in your head. Not really, right? These things do affect a lot of women. In fact, it's about 10% of women have suffer from endometriosis, and 5 to 12% of that 10% would suffer from bowel endometriosis, which is where it's affecting their digestive system. Some may have the endometriosis growing on the intestines and colon and rectum, and that would cause things like constipation, upset stomach, nausea. All right, so, but it could cause that same effect or similar effect even if it isn't growing on the digestive system, on the GI tract. All right. Now, what I want to tell us is, or talk to the citizens about is, many people focus on treating these conditions or doing surgery to try to get it removed, aberrations where they try to burn it and whatnot. And not too much focus is placed on cause. Now we know they say the cause is not fully understood, or isn't, it's just theories that there are with regards to cause. But let me tell people something, because I've been reversing these conditions, and many conditions that the medical world don't know the cause of, or say it's just idiopathic. These things come down to one of the major factors that affect our health and we pay the least amount of attention to, and that has to do with our nutrition.
Right.
Our nutrition affects our health more than the air that we breathe. Our nutrition affects our health more than the other environmental factors that we are around, because of the fact that our nutrition today is very raw. Very, very raw. Now, if the nutrition today was accurate, the air would be the major cause of illness, right? If you're consuming polluted air, but people would not have been as sick. But today our nutrition is so severely off, right, that we are suffering from a lot of sickness and diseases, right? Now, many people with endometriosis born with it, which indicates to me that their parents were unhealthy. Now, notice I say parents and not parent. Because, you know, again, a lot of people like to throw the blame on the mother, because a lot of men believe because she's carrying the child, that is on her to keep herself healthy so that the child would not come out with health problems. When the reality is a lot of health issues stems from the father, because a lot of men do not take care of their health, and they are of the belief that it's more on the woman to take care of their health, not knowing that their sperm is damaged based on how they take care of themselves, right?
Yeah, I think that's a factor. I think women will go for more checkups and see about themselves than a man. Men to me, we don't like to go by doctor and thing.
60% of infertility is of the fault of the man, right? Which means, of course, from next week I'm going to be dealing with topics that affect male fertility, because I've been focusing on female infertility, because endometriosis, apart from it causing pain and excessive bleeding and gastrointestinal problems, infertility is one of the issues as well. In fact,
I see that here.
In the past couple of weeks, all of these things that we have been dealing with have been focusing on the female reproductive system and things that affect it, right? But I will take a look at some stuff that affect men as well, and including so-called male menopause, which I have been observing in men that are happening at a very, very early age.
Male what?
Right? And menopause. But
male
we'll
menopause.
go into the correct term and stuff of that when we deal with those topics. And men aren't aware of it, but many of them, even I'm seeing stuff like that happening with men in their teens and all. Right? So a male's health is terribly off today. Right? So don't pay attention to the yes, it's endometriosis. I want to tell the female community out there, if you want to understand your body to the point where you can reverse your conditions, come on, check me, book an appointment. Right? Book an appointment, re-educate yourself, understand what you are biologically, genetically, morphologically, and physiologically designed to consume. Right? Because these conditions, if these things are there from birth, it means that there were problems during the conception process that lead to epigenetic issue that would have caused the child to born with these conditions. Right. And in order to fix these conditions, one has to safeguard themselves now, make the changes now, so that they wouldn't allow their offspring to be born predisposed to these issues as well. So we need to get more serious with health, and we need to understand that what we eat on a daily basis affect our health more than anything else. 99.99% of the toxins that the human body consumes on a daily basis comes from what we deliberately put into our bodies. The other 0.01% is from the air and from other contaminants around us, and that is what we have been focusing on, and not focusing on the biggest elephant in the room, which is what we are directly eating. So that's how I reverse diseases, through education. Knowledge is power.
Knowledge is power, right through, man, and we hope that people are better off for it after each segment. So Seth, thanks a lot, and people, the numbers are on the screen there behind Seth, 7611952-2793935. If you want to book a consultation, if you want to get the information, if you want to get more knowledge and educate yourself, give him a call today, all right, and book that consultation. Seth, until next week, man, have a good one.
Thanks for having me. Take care.
Yeah, man. All right, people, so with that